today we're talking about health insurance, which is very important that we talk about because most people do not even understand what health insurance is about. Most people do not know if it is really important or necessary to have a health insurance, what it entails, the plans that are available. So all of this is what we'll be talking about today on Tea or Coffee, our Wellness Wednesday. And our guest is Bimbo Oyedokun, and he is a health management consultant. You're welcome.
Thank you.
Thank you. Good morning.
Good morning.
How are you doing today?
Oh, fine. Thank you for having me here.
Oh, you're welcome. So it is, first, before we get into the topic, I'm sure there are a lot of people that don't really understand what health insurance is. So can you define it to us? What is health insurance?
Okay, so let's use simple terms. When you say health insurance, it's similar to any other kind of insurance. You have insurance for your car. So you insure your car in case something goes wrong, in case there's damage or loss to your car. Health insurance is you get yourself insurance in case you fall ill. So, but health insurance is one where you find out that the insurance companies that go into health insurance, you need to have a bit of a stronger kind of heart because the likelihood that a human being is going to fall ill is higher than the likelihood that the apartment is going to catch fire. So, but health insurance is something that you should have. The most common variant that is practiced in Nigeria today is what is called managed care. And managed care means that you're providing a defined set of services. So that means you say beforehand what is covered, what is not covered. To an enrolled population, that means it needs to be to a specific set of people who can be identified. And the purpose why you are doing that is twofold. One is to improve health outcomes, and two is to reduce costs. So that's an overview of what health insurance is today, especially speaking to the Nigerian experience.
Okay, so on the average, what does a health insurance policy entail?
Okay, so in Nigeria, let's describe what your basic health insurance policy in Nigeria will cover. It will cover you to see a general practitioner for whatever complaints you might have. So to see a GP, a general practitioner, for primary health care. So you have a cold, you have a headache, whatever it is, your first complaint, it will cover you for that. It will cover you for whatever medications that person might prescribe. It will cover you for basic investigations. So I mean, everybody in Nigeria has at some point in time or the other had malaria. So things like malaria perhaps. So those basic investigations will be covered. It will cover you for a basic plan nowadays. You cover you for admission in a general ward. So that means you won't be the only person in the room when you're on admission. You probably have maybe 2, 3, depending on what the particular hospital determines to be their general ward. What else?
So, what would the basic health plan not cover?
What won't it cover? It might not cover you to see a specialist. It might not cover you to be admitted in a semi-private or a private room. It might not cover you for advanced surgeries. A basic plan should cover you for basic surgeries, minor to intermediate surgeries. It might not cover you for more advanced surgeries or more intensive surgeries. It might not cover you for things like optical. I think a basic plan should cover you for dental up to some extent. So it might not cover you so much for your dental, but at least basic dental care should be covered. It might not cover you for optical or beyond an ophthalmologist or optician's consultation. And then you probably will pick up the cost of the lenses and frame and all that by yourself if you choose to go ahead with that. So your physiotherapy coverage might be limited. So it will cover, what I would define as a basic plan should cover most of the basic facets of healthcare up to a certain extent. So, and in Nigeria today, you can still get a health plan that covers you that well for 15 to 20,000 naira per annum, which
sounds cheap, yes.
Which is extremely cheap, yes.
Wow.
A basic health plan can still cost you 15 to 20,000 naira. If you choose to buy from into the National Health Insurance Scheme, they have something called the Voluntary Health Subscriber Scheme, something like that. They have the voluntary subscribers. I think it's about that 15,000 naira. And that even has quite a wider bouquet of coverage than what many of the private health insurers can afford to offer you.
In that case, let's talk about the different plans under health insurance. PS, please, no brand names.
Yeah.
Exactly. I'm not. I haven't received any sponsorship deals
Thank
from any
you.
of the health insurance companies.
Okay, so let's talk
no.
about the plans under health insurance policies.
So, the plans that you have, let's just describe them as you can have basic plans,
Okay.
you can have intermediate plans, and then you can have the high-end plans. The high-end plans can do things as far-fetched as, taking you abroad for treatment, covering you for things like cancer care, infertility treatment, advanced surgical techniques, and co. If you're paying a plan that probably for an individual is costing you 200,000 naira, 300, 350 per annum, or 400,000 naira per individual, or higher. Some plans are charged in dollars. You can buy international health insurance if you want. You understand? So a lot of companies that have expatriates do that. So it can go that high. And then you can have the intermediate plans. Now, the industry is a competitive one. So you have somebody saying, I'm offering this plan under this name. So somebody can decide, I'm just offering you 3 plans. Some other health insurance company can say, we have 5 plans because they want to differentiate for as many people as possible. So you have the intermediate plans, which will probably be giving you things like, I want to be in a semi-private room when I'm on admission.
Okay.
I want to be covered for some health insurance companies will say 6 sessions, some say 10, some say 16 sessions of physiotherapy. So that's where the differentiation comes in. But the beauty of health insurance is that the more people that have health insurance, the better the system works, because everybody's still going to get a certain basic level of care.
Okay.
The differentiation will be in, you have access to some things that somebody who didn't pay for that doesn't have access to. Or perhaps you are in fairly more luxurious conditions if you have the mind to be looking for luxury when you're on admission, when you're ill. So those are the differentiators. But once you are signed on to a health insurance policy, you at least have some sort of peace of mind, because Nigeria is a country that I'm sorry to say is always making attempts on the life of its citizens.
Oh yes, considering the life expectancy.
Yeah, life expectancy is 53.
It's a sad.
The country is almost always attacking you in one way or the other. So
Like what doesn't kill you will kill you someday.
exactly. So health insurance is one way you can try and protect yourself in some measure, especially financially, because for a lot of people, you find out that at that moment when they have a healthcare need, they may not have cash at that point in time. No matter who you are, you may not have cash at the point when you need care. If you have a health insurance policy, you skip the cash part of the whole loop, and then you go straight to receiving care. So that's one of the most important reasons, because you have, anything can happen. An accident can happen at any point in time.
Yes.
Vehicle accidents, you know a lot about that. Look at the roads.
Yes.
We know the situations.
Exactly.
Yeah.
Domestic accidents, and then the good old malaria. Which
Make
is
that bad.
Yeah. So there are so many possible risks to your health as a Nigerian that really it makes a lot of financial sense and also a lot of sense safety-wise for you to have a health insurance plan.
Insurance plan, yes. Okay, so excuse me.
Okay.
Go ahead. Do you want to
All
say
right. So
something?
while you was talking, you mentioned something about some people that subscribe to international plans. So, for example, you're a Nigerian. You are a Nigerian, and you subscribe to an international plan simply because you can afford that luxury. What is going to happen to you if you come down with a small infection? Do you always go there, or is it that they have
So
affiliates?
those who have the international plan, it means that they have access to going to have healthcare when they're abroad. So
okay.
you want to go and do a desert safari in Dubai, and you want to know that should you hit your head on the desert ski or whatever it's called, you can get care
Okay.
without having to start looking for cash there.
Okay.
That's probably that's the kind of thing.
So it covers
you're the
home
kind
and
of person,
abroad.
or you're the kind of person that likes say, I'm going abroad for my checkup. So that kind of thing probably will be covered there. So and then of course once you're buying an international plan, you don't expect any considerations. You don't expect anybody to be considering you on price. You're going to pay for the premium service that you're looking for.
Yes.
So, but of course, if somebody who has an international plan has a cold while he's in Nigeria, I think it would be extravagant to get on your private jet and fly to
Well,
UK to go and get a cold treated. But hey,
if you can afford it,
some people do it. But really, you don't need to do that. You can you will have coverage in country as well.
Because I've heard of some people that have this long-rooted or deep-rooted distrust in the Nigerian healthcare system.
Yes.
Yes.
Okay, yeah.
So any little thing,
They're just out. They just go out.
Well, they have their quids, their pros. They have the points, and they also have no points. Let me put it this way: the Nigerian healthcare system has some of the most competent people you're ever going to find. But what conditions are they working under? And also, you have a situation where sometimes people have actually been known to go abroad and be misdiagnosed and then come back home to get properly diagnosed.
Interesting.
So things, it's not really that hard and fast. But generally speaking, yes, we do lack a comprehensive, properly put together healthcare system in Nigeria, just as we lack a system on pretty much anything. Aviation, I mean, where do you see a functioning system in this aviation justice?
Justice, yes.
I don't want to throw those stones right now.
We're getting off course. So the thing is, yes, as a country, we do need to improve our healthcare system. And it will take political will, it will take organization. In short, it will take us to get on our feet as a serious country. But in the meantime, you can get good healthcare in Nigeria if you know where to go and you go on time as well. I mean, if you've got a problem and then you stay at home and you're anointing yourself with holy water.
We will get right to that.
We will not throw some shades.
And at the point of convulsion, that's when you get to the hospital and you say, oh no, those Nigerian doctors are not good.
We will.
You know, that's on a lighter note. Now, I'm sure there are some things that we need to consider before we choose or pick a health insurance plan.
Yes.
And we'll get right to that. But we need to go on a quick break. You can join us tomorrow for another exciting episode of Tea or Coffee.